Kristi Henderson is the incoming Institutional Council Chair for ATA and the Chief Advanced Practice Officer and Director of Telehealth for the University of Mississippi Medical Center. Well, thank you for joining us. Now, you've been on the council for a while. You've been Vice Chair. What issues are you working on right now, and what do you continue to work on throughout the coming year?
Yeah, thanks for having me. So last year we really spent a lot of our time trying to identify the challenges institutions were having with selecting equipment and technology to develop their platform for telehealth. And so we all had unique challenges working with our electronic medical record and how does all this integrate together. Some of us had been doing it for many years, some of us were brand new, but all had unique challenges. And so we spent the year really working with the industry council to have them hear our concerns and our needs so that they could then have their research and development teams work with us to develop the strategy that made sense. So we'll continue on that platform over this next year, but we'll really look at how can an institution work to integrate this into their health system and not have it as a distinct service line, but it's integrated into every service line as the whole model of healthcare delivery uses technology more and more. And so some of us, and that's the benefit, I guess, of this council, is that we'll be able to learn from those that have been doing it for many years, and others that are brand new can benefit from those lessons learned.
Now, what are some of your other goals? What two issues would you like to tackle within the next year or so?
The two main goals we'll work on for this next year are, one is full integration of telehealth into industry and institutional entities, healthcare entities. And so we'll do that by identifying those barriers, and some of us have overcome those barriers in our state, and that's at a state level and a federal level. But what are those key strategies that we need to be aware of, and how can we all work together to overcome them? And so, for instance, in my state in Mississippi, we've been successful with reimbursement legislation. So how can I help other states do the same thing? And so we'll identify those major barriers that affect viability and sustainability of your program, and then we'll teach each other and work together.
Why is it so important for healthcare institutions to be members of the ATA?
Because there's so many of us that have taken on pieces of this and have had successes, and I wouldn't even call them failures, but have learned from previous pilot projects and have refined their model to work. And it's a great resource for everybody to come together and to be able to learn from others, to be able to network, and to be able to use what's worked in one state in another state, and just have more sustainability of your program.
All right, Kristi Henderson, the incoming Institutional Council Chair for ATA and the Chief Advanced Practice Officer and Director of Telehealth for the University of Mississippi Medical Center. Thanks for joining us here today.
Thank you.